Hi, I'm John from Trinity EMS.
Hi, I'm Rick from Trinity EMS, and we're going to talk to you a little bit about the opiate crisis and the opioid crisis and give you a quick overview of some of the things that we have learned about the opioid crisis. One of the confusing things, people hear opiate and opioid and are not sure that the two terms, are they interchangeable or are they not? An opiate is a true form of an opiate, which it comes from the poppy plant. Opium, morphine, heroin, these are all opiates. Opioids are synthetically manufactured versions of an opiate, and these are things like Percocets and OxyContin, the pharmaceutical grade opioids that have the same intent as far as managing somebody's pain, but also have the same risks for addiction and overdoses.
And the crisis as it's expanding. In 2015 there were more heroin deaths in the United States than gun deaths, and that was the first time that happened. The life expectancy for the average American dropped for the first time in 20 years. In our service here, right here in the Merrimack Valley, it was May of 2014. Really, everything changed for us. When we look through the data, so in 2013. Every 3 days, a Trinity crew would participate in a call where somebody was saved from a heroin overdose. So every 3 days, one of our crews would interact with somebody that needed Narcan to be revived. In 2017, it's every 17 hours.
And when we talk about Narcan, Narcan is naloxone, and here we see the intranasal version of naloxone, and what it does is it competes with the opioid or opiate on the receptors. So basically it displaces on the cell the place where the opioid would be and affecting that person. So the Narcan is safe to use for somebody. It's not going to harm somebody. It's not like giving somebody a medication that may injure them, such as a insulin or any other cardiac medication. The thing about Narcan is that it is only going to have an effect on somebody who has taken an opiate or an opioid. And the goal here is to, again, displace the opioid or the opiate from the cell and take away those symptoms. And the symptoms that we see from an overdose are pinpoint pupils, change in mental status, and respiratory depression. Those are the hallmarks of an overdose that we're going to hope to reverse from with this Narcan.
About 75% of the patients we deal with are males for the opiate crisis, and it's actually a little bit older than I think most people think. The average age is 38 for a male and 37 for a woman. So I think people's perception is that it tends to be younger, but at least in our experience, they are older. And speaking with other ambulance services across the country, they're seeing the same thing. So what to do if you see 911 outside of the hospital environment? Call 911. Absolutely, call them first right away. If it ends up not being an overdose and it was mistaken, maybe the patient had some other issue going on, not medical, don't worry about it. About 25% of the time EMS responds to a patient. We don't actually take anybody to the hospital, so 1 out of 4 times we respond over and we don't bring anybody. So it's okay, don't worry about it, don't let that delay the care. If it's safe and you can do it, stay with the patient. You can relay important information about the patient's changing condition to the 911 operators. If you're trained and you have Narcan, you can provide it. If you're trained and you have the protective equipment needed, you can provide that rescue breathing, which is critical to helping to sustain that person until the Narcan can take effect. And then if you have other people around you, if you can kind of go outside, give some information to where 911 should go when we get there. If you can clear out any obstacles to the care, that will help speed things up as well.
One of the things we've recognized over the last few years as this crisis has gotten worse is the change of mentality in how we handle these patients. And these people are victims of a crisis. They're addicts. So we want to be sensitive to their family members. We want to be sensitive to the patient. Nobody woke up today, decided that they wanted to be a heroin addict and that they wanted to overdose. They're in a bad place. And we want to be sensitive to that. We're all trying to preach that this is certainly a disease. We're going to treat it like a disease. You wouldn't tell somebody that had congestive heart failure to slow down your breathing. You'll be okay. You wouldn't tell somebody with a broken ankle to walk it off. So when you tell somebody that has an addiction to just stop taking heroin, stop taking the pills, stop dealing with opioids, That doesn't work either. These people need some training, and we have to get them into a rehab so they can get the care they need, so they can recover from this disease and move on with their life.
So we thank you very much for your time and the opportunity to speak with you. Good luck.
Thank you.